This is Shannon Dick for Body Hoops Level 1 Instructor Training. I'm going to go over basic waist tubing and the front hand lift up. For starting with basic waist tubing, I'm going to start without the hoop first so you can see the motion. You're going to take one foot, it does not matter which foot, place it slightly in front of the other, just one step, and you're going to move from your core back and forth. It's a rhythmic back and forth motion. You can try it with the other foot, whichever one is comfortable for you. You just have to go back and forth. Some people's first inclination is to do a big circular motion. You don't need to do that. Small, back and forth. Make sure that you're standing upright, that your head is up. If you bend over, the hoop will go in a vertical rotation instead of horizontal. So you want to make sure you're up straight, good posture, and keep that core moving. If it starts to fall on you, down around to your hip area, you can make your rhythm faster, and you can also bend your knees a little bit more so you're a little bit lower, and bump it back up. So you're just going to make that rhythm faster, move from your pelvic area, and bump it back up. Now, I'm going to show you the basic waist tubing with the hoop. Remember again, you stand up nice and straight. You're going to place it on the small of your back. It does not matter which way you throw the hoop, whichever is comfortable for you. I happen to hoop to the right. So I'm going to give it a good, steady push to my right. You don't want to throw it crazy or lazy. A good, hard, steady push, and immediately start your rhythmic motion at your core. You can put a hand on your belly, a hand on your back, to see what this rhythm feels like, to feel what your muscles are doing. You can try stepping out with the other foot. Remember, if it starts to fall on you, go faster, dip down and bend your knees a little bit. This is what recovering the hoop looks like. Also, for basic waist tubing, you might find it easier to turn with the direction of your hoop. I hoop to the right, so my turn would be to the right. It would look like this. You can see while I stand still, I have to move my core faster. The hoop is hitting my belly here, here, here. If I turn, you'll hear it slow down. It's hitting me here, 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 again. Here, here, here. That move will be important when we go over the front hand lift up. Now, for the front lift up, again I hoop to the right, so I'm going to use my right hand and cross over. If you hoop to the left, use your left hand. This is your leading hand, your leading side. So I hoop to the right, I'm going to use my right hand. I'm going to cross over to my left hip bone. When it goes up, I'm not going to grip the hoop. I'm going to cut my hand and lift straight up. This is a fairly quick move if you are standing in one spot and not turning. It will go in between the index finger and your thumb as soon as it rolls over on that side, or is getting ready to. Dip your hand in and lift it straight up. There you can see that it's quick. I'll bring it back down. I'll turn with this move. It allows me more time to think about when I'm going to stick my hand in there. So I'm going to turn with this. Gives me more time to think here, and I can continue to turn as I lift it up. There's the front lift up. You can also turn with the halo drop down to bring it back down the waist. Stop it here. Put your other hand here. You're in the hoop. Turn. Bring it down close to your waist. And give it a good strong fling again. I'm going to turn again to do the front hand lift up. Slows it down to make it a little bit easier. And that is all for basic waist tubing and the front lift up.